Adrian N. Breitfelder, City Clerk, you are hereby directed to call a special session of the City Council to be held on Monday, May 19th, 2025, at 6 p.m. in the historic Federal Building for the purpose of conducting a work session on the Community Foundation of Greater Dubuque's Contracted Services Agreement Update.
Thank you. Good evening and welcome to a special session of the Dubuque City Council for May 19th, 2025. As a reminder to viewers and listeners, due to the nature of tonight's meeting topic, public input is not accepted. However, you may contact the City Council directly from the city's webpage at www.cityofdubuque.org/council contacts. Attendance for the session is as follows. Mayor Kavanaugh.
Here.
Council members Farber.
Here.
Jones.
Here.
Resnick. Here. Roussel.
Here.
Sprank.
Here.
Wethel.
Here.
City Manager Van Milligan.
Here.
And Senior Counsel Lindahl.
Here.
Thank you. Our work session topic is the Community Foundation of Greater Dubuque's Contracted Services Agreement Update. I will turn it over to the Community Foundation's Alex Baum.
Good evening, everyone. Mayor Kavanaugh, council members, staff, City Manager Van Milligan, thank you so much. Also, it's a pleasure to see you out again, and wonderful to know that it was the desire to see my presentation that helped really drive your recovery, I'm guessing. Well, my name is Alex Baum. I'm the Director of Advocacy, Data, and Learning at the Community Foundation. And I want to provide you with an update on some of the contract services that we've been doing. This is going to be a little bit of a different update than what we have normally presented to you, however. There have been a lot of changes that have taken place over the past several months within our community, and a lot of communications we've had with nonprofits, partners, community members, and others. So instead of an update on all of the work that we've done over the year, we'd like to present you with some of the findings and some of the data that we've been gathering over the past months and where that is leading us to go in the future. So we'll be kind of talking about some of the concerns of our local services system and the services that are presented. And for the agenda, we'll first start off kind of reviewing some of the data that we've collected and then talk about the work that we are going to be doing going forward. So I want to start off with a data that was collected from Project Hope, which was a vulnerability matrix that we conducted with city staff and other partners from the community. Now, the way that this worked was we basically brought together a number of key economic mobility leaders within the community to look at different threats, issues that might be coming up, and to try to rate them in terms of their impact versus the immediacy of what's going on. Now, you're not meant to read this document. This is just to show you that we put in the legwork. But some of the key takeaways that we got from this exercise, right, and this is kind of a pooled knowledge base from the different stakeholders that take part in Project Hope, was that the three most consistent concerns had to do with the impact of federal and state funding cuts, the economic impact of federal policies on our community, and the impact of immigration policies. Those were the three areas that were kind of highlighted the most and came up most frequently, but there are other issues as well, such as public health communication issues that were really highlighted as potential things that we as a community should be keeping in mind given some of the federal policy changes that we've been seeing. We've also held 2 different surveys and a series of different communications with nonprofits in order to try to gather that information and see what responses, what insights and experiences those nonprofit organizations are having right now. So from all of these, we were able to gain direct reports of at-risk federal funding from 24 different organizations, totaling 33 different programs within our region and upwards of $131 million. You can see some of the breakdown right now. The reason that the human services pile is so large is because of threats to Medicaid and Medicare funding, which makes up the large part of funding for certain organizations that have contracted out with those different programs. A number of the nonprofits that responded talked about their concerns about whether they would be losing some of this federal funding. It was a total of 87% of the responses that we did receive said that there was a significant concern about loss of federal funding. And when we asked organizations about how they might respond to these areas, of the ones that did respond with future plans, about a third thought there might be a possibility of furloughs or laying off staff. Nearly 90% thought that there would likely be a reduction in services if they lost funding. About a little over half, 56%, thought that they might need to close one of their programs, and only one organization but thought that there could be the potential of shutting down services in the near future if they were to lose that federal funding. There were also a number of things that were highlighted about the needs that nonprofits had when thinking about these issues. The largest need was around additional funding sources to try to make up for some of that lost funding. Education of the public about what's taking place with things like AmeriCorps volunteers and other needs, answering questions and providing direct assistance, assistance with different programs that are taking place, and then advocacy, collaboration, and training as different options that people wanted. Then I want to talk to you about the conversations that we've been having within the Better Together Committee and within the Food Provider Network, specifically about some of the changes, because there's a lot that's been happening within those two areas. So as a reminder, the Better Together Committee works with addressing systemic barriers facing immigrant and migrant populations in our community. And a big reason why this is so important is shown by this graph right here. So between 2010 and 2023, 96% of the population growth in the city of Dubuque can be attributed to growth in immigrant families. That means either individuals who are foreign-born or who are native-born child with foreign-born parents. Within the Community Foundation 7-county region, that number is 212%, so a pretty significant growth. And here's kind of what that looks like. This is the growth of population in the city of Dubuque since 2010, according to the American Community Survey. And this is what it would be without those different immigrant populations. So kind of looking at it, I also wanted to present on some new data that we have started to look at regarding immigrant populations within the workforce. Now, unfortunately, there is not easy data to be able to take, but we've conducted some analysis that we think provides an approximation, kind of a conservative estimate of the number of foreign-born workers within our community. So between 2010 and 2024, according to the quarterly workforce indicators put out by the census, there were about 5.6 thousand additional workers within Dubuque County that were added over that period of time in total. About 30% of that were foreign-born workers during that period of time, or about 1.6 thousand. Now, that's from 2010, but in 2015, that's when we started to see a decline in the number of domestic migration within our county. That means the number of people coming from other counties in the U.S. to Dubuque. There tended to be a decline in that area starting in 2015. So if we look from that time, about the last 9 years, there's actually overall been a reduction of about 110, 114 workers, most of that because of a drop during the COVID pandemic that we are now climbing back up and getting to. But if you break this number down, you can see that that is actually we've gained over 1,000 foreign-born workers during that period of time and have lost about 1,100 native-born workers. So that's where that number comes up. And we can break this down by industries as well. So for manufacturing, about 20% of new workers during that time frame are foreign-born. Education services, it's a little over 20%. And for the healthcare industry, it was a whopping 87% of new workers between 2015 and 2024 came from immigrant populations. We can also see the breakdown here of what the estimate was for 2024. It's a little hard to see this, so a way of thinking about it, kind of losing these workers or the impact if these workers were gone. 519 manufacturing employees is about equal to 1.5 Simmons Pet Foods. 410 healthcares is about half of Finley Health, or Finley Hospital. And 307 accommodation and food service workers is about the equivalent of the Diamond Joe Casino staff. So those are the kind of workforces that we are talking about right now. The Better Together community in conversation with these populations and work through advocates have found that there's a significant amount of fear within immigrant populations within our community right now, and many of them are kind of withdrawing from public spaces a little bit more. There's also increased reluctance from businesses to engage on some of the long-term work that we were doing that may be in part due to overall kind of economic projections, and we've heard from a number of businesses that hiring and expansion plans are being scaled back recently. But some of it is also due to what we previously thought of as less controversial areas like employing international students becoming something that is a little bit more challenging to have conversations around. Speaking of which, we've also seen a number of impacts on college students in our area due to the recent visa cancellations. Now, those policies have been reversed, but from national sources that we've talked to, it seems that it is likely that there might be other plans in the futures to withdraw some of those student visas that we might see within our community. And there's been a few students within Dubuque that have been impacted by those cancellations. There are a number of new vulnerabilities for families that have come up that we are trying to think about, and then just in general, a lot of uncertainty for nonprofit organizations working this time about what federal policies will be. A lot of those federal policies right now have court cases that are taking place to try to discern, what's going to happen. Just today, I believe there was a Supreme Court ruling about Venezuelan temporary protected status that had a pretty big impact on some of the community members in our region. But these are some of the things that we have been hearing from the Better Together Committee. And then finally, from the food provider network, there were already some trends over the past few years that were going in the wrong direction, right? Increase in costs and fewer donations, combined with manufacturers and wholesalers not creating as much excess as they normally would, which is something that the food provider network often uses as a source for new food coming in. But this has been exacerbated by the cut in USDA funds to food providers, which is a major concern for the network, as well as the cut in USDA funds going to the Iowa Food Hub in our area, which will impact a lot of the farmers that grow vegetables and other crops. This will have both a short-term impact because of that loss of funding, but also a longer-term one because the Iowa Food Hub was something of a market, right, a destination. If you think of people growing feed corn or soybeans, there is a system and a marketplace for them to be able to sell to and to be able to expect how many crops they should be selling. That doesn't necessarily exist in the same way for Iowan farmers selling tomatoes or vegetables. And so the Iowa Food Hub provided some of that certainty, and if there's a loss of federal funding there may be less certainty going forward for some of those local farmers. In addition, the food provider network expects that there will be some impact from imported foods because of the tariffs that we're seeing, as well as some policies that may impact domestic production, including policies targeting agricultural workers or that affect them, especially immigrant populations, and tariffs impacting inputs like fertilizers from Canada, for example, may cause a rise in prices. That all kind of leads to the big concern about the supply of food going forward into the summer and into the fall and what that will necessarily look like. The analysis that the food provider network has had is that this will likely not have a disabling impact on those larger providers, right? Riverbend, St. Stephen's, the Dubuque Food Pantry. But there might be smaller providers that do lose their ability to serve kind of more niche populations that aren't being served by everyone. If you think about homebound senior citizens, immigrant populations, individuals with disabilities, kids, those might be the groups that see a decline in service that isn't covered up unless we're paying very good attention to where those gaps start coming up. So that was kind of a brief overview of the data that we've seen. I want to kind of talk to you now about what we're thinking of, how we're thinking of responding this and monitoring it going forward, because there's still a lot of uncertainty that happens with this data. So for Project Hope and kind of economic mobility, specifically, we'll look at collecting data on the local impact and trying to see what is taking place and tracking that data, as well as tracking some federal and state policy changes, legislation, executive orders, other areas that have to do with economic mobility. Elevating new needs and challenges, being, having our ear to the ground and being able to rise that up. And then also putting forward a plan about how to conduct economic mobility work in case there is an economic downturn that we see over the coming months or year, which it looks like there is some data that suggests that might be possible. For this last part, we actually talked about this on Thursday as part of our Project Hope stakeholder meeting and came up with this, initial plan. The first is to do what's called triage workforce engagement. That means responding to new areas where there are rising groups of people who are unemployed or need jobs or access to further education, and updating some of our workforce pipelines as well. So for example, if there are a group of Marshallese individuals who are becoming unemployed, how do we redirect our pipelines to be able to, work with that population, and how do we connect them to job training opportunities that really lend towards things that are needed by companies right now. Things like CNAs or registered nurses are job positions that are probably going to need to be filled even if there is an economic downturn in the coming months and a slowing in hiring. Also responding to rising needs. We've already heard some evidence of increasing utility requests, help with utilities following the moratorium on utility payments that are coming up. We're still trying to follow up and see how big of a jump that normally is, but we want to keep track on what kind of needs that we're seeing. We want to monitor the system to make sure that there aren't, with some of that loss of federal funding, any gaps that show up or any kind of critical failures, and make sure that we're able to address them. And then to think about vulnerabilities. I think the COVID pandemic taught us that a lot of times when we see a gap, that was an existing problem that was exacerbated by a situation, right? It is not, there may be underlying challenges there. So if we start to see those problems pop up, we want to have a short-term solution, but also think long-term for how do we resolve some of those issues. In our work with nonprofit organizations, we're going to continue those check-ins and those close conversations, try to bring together other local funders to coordinate activities and to share information, and monitor what is taking place with our nonprofits, right? What is the health of our service industry right now, and what's the best way to think of that going forward? The Better Together Committee has been working on Know Your Rights documents in order to help people be able to understand what their rights are and how to be safe given their legal status. Connections to local attorneys. There's been a need for a power of attorney and standby guardianship work to help families right now, and there's actually been a terrific group of volunteer lawyers who have been helping families over the past couple of months. We've started to dedicate funds to be able to help families that might be in crisis due to a loss of job or another issue that takes place. Continuing to engage with international students and to work on making sure that they are protected and that they feel welcome and comfortable here in Dubuque, and helping to coordinate volunteering and fundraising work for those different organizations that work with immigrant populations. And then finally, just continuing the work that we've been doing already. For example, in January of this year, we launched with the partnership of the Dubuque County Health Department an online database of trained Marshallese and Spanish medical interpreters. We've talked before about how we were planning to train community members. Well, we've done it. We've trained about 12 Marshallese community members and have either trained or in the process of training 25 Spanish-speaking community members. And now we have an online database that is up on the Dubuque County Public Health Department site where any healthcare provider or business or anybody else can go and contact a trained interpreter in those two languages, which is something that we haven't had in this community before. And then finally, for the food provider network, we are going to continue with having those regular meetings, monitoring where there might be shortages or changes to food supply, and also launching some additional outreach to immigrant communities has been a new initiative that the food provider network has decided to take up. Now, that was a heavier conversation, so I do want to leave you with a more positive thought for the last thing that we are going to be doing going forward, which is around data, which I know is already cheers you all up. But specifically for the data walk that is going to be taking place later this summer once we have the data worked out. A few weeks ago, I was at the Philadelphia Fed Economic Mobility Summit in Philadelphia, where there the kind of rock star presenter that came and presented was a man named Dr. Raj Chetty, who is a professor at economics at Harvard University. I'm not sure if you're aware of his work, but a report that he has put out in 2014 and has continued to update as kind of one of the defining economic mobility reports for the United States, talking about how individuals have been able to advance and move out of poverty in communities around the U.S. This has been a huge impact. For example, we have partners in Charlotte, North Carolina, who ended up being ranked 50th out of 50 large metro areas, which was a shock to the community, and they have started all of their economic mobility work to try to address those underlying problems. Now, I'm going to show you, this was a slide that he presented at the summit, and I wonder if anybody can identify something very interesting that might reflect on our community. That's correct. Dubuque was actually the example he continuously gave throughout his presentation for a high upward mobility community. He would say, you know, how do we make our communities be less like Charlotte and more like Dubuque, Iowa? I will tell you, I was a little bit surprised. I tried to make eye contact with everybody in the room as I was there. But it was very exciting to see us recognized by some of the premier people working on economic mobility work as the success story that should be emulated for other communities in the U.S. And so that's what we are going to focus on our data walk. We are going to look at where do we actually rank in terms of economic mobility? What, you know, how high of an achievement have we had? What are the reasons for this? What are the different strengths of our community that have led to this? What might be missing from some of this information, and specifically who might be missing from some of that economic mobility data, and what are some things that we can do moving forward to make sure that we continue this legacy of being a highly upward mobility community. We'll be sharing kind of a date for that in the coming months once I actually do the work for the data walk, but very excited about, you know, kind of showcasing this success story that we've had at our community and what that might mean for us going forward. Thank you, everybody. I appreciate the time, and I'm happy to answer any questions or to have any comments.
Well, Alex, that was fascinating in multiple ways. Bit of a shocker at the end there. That's something. Maybe Dr. Shetty would like to join us for the data walk. Yeah,
I could send an invitation. Yeah.
Yeah, I think that invitation should go out. We have time for one question, and then we're going to have to skedaddle on to our next meeting here. Yeah, Ms. Wethel.
Mine is more, I think, a request, and maybe it's already in your plan for the data walk, but as it relates to the Better Together Committee and looking at such an impressive number of our growth in our community, especially workforce being those of the immigrant population. As a council, I'm interested to know how can we best support those individuals as it would relate to transportation and housing. And so I'm sure you will focus, from what I remember of the data walk, that is a topic, both topics that we'll hit, but I'm really excited to see what other information you have to offer that's updated on that.
Absolutely. Yes, we will be focusing, and I can just tell you anecdotally that housing specifically right now has been a major concern for immigrant populations. I think it is a concern for a lot of people in Dubuque. We have a housing shortage in a number of different areas, But for a lot of immigrant populations who work on word of mouth in order to be able to identify housing options, that takes that limited pool and shrinks it a little bit further. With rising costs and possible changes to employment status and other thing, it's something that we've been keeping an eye on. But yes, that is a great suggestion, and I will absolutely include it in the data walk.
Now, I'll ask the final question. So, because I want a point of clarification here. When you say the words immigrant community, you mean the full spectrum of the immigrant community, do you not? I mean, people who are here who are citizens, who are naturalized citizens, who are maybe here on a visa of some sort, and people who are undocumented. Am I understanding that correctly?
Yes, absolutely. And including, when I talk about immigrant populations or immigrant families, I'm often talking about people who may have been born in Dubuque as well, right? If you are a Marshallese child growing up in Dubuque and going to middle school here, you are absolutely a Dubuquer, as is everybody else who resides here, but there are aspects of your culture and your experience and maybe your language proficiency that reflect those needs of different immigrant populations. So yes, it is a very wide group, from international college students to people who have their green card to transfers at the John Deere plant, the whole gamut.
Great. All right. Well, thank you very much, Alex. Thanks for all this information. We look forward to the data walk and finding out the date when the date is ready, and meeting Dr. Chetty when he shows up to be a part of that data walk too. We will be adjourned for about 1 minute until we start our next meeting.